Joanna, are we good to start?
Yep, you're live.
All right. So welcome to our webinar, and thank you for being here. This is a webinar for vascular surgery program directors responding to evolving strategies during this upcoming vascular surgery interview season. So my name is Kelly Kemp. I'm from Tulsa, Oklahoma. I am co-moderating this webinar with the one and only Evan Deutsch from Jefferson Health Medical Education in East Norrington, Pennsylvania.
Thanks for the kind introduction.
So it is the beginning of interview season for vascular surgery. Congratulations to everybody. And thank you for being involved in interview season and opening up your doors to new possibilities and to new trainees. So first, we would like to introduce our panelists. Mary Ottinger from University of South Florida, Morsani program. Loy Kabani from Henry Ford Hospital program in Detroit, Michigan. Charles Shirley, who is our vascular surgery resident from University of Arkansas for medical science. And then finally, Elena Kirgoga from University of Washington in Seattle, Washington. Thank you, everybody, for being here. And thank you for our leadership, Ben Pierce and Don Coleman, for initiating this awesome webinar series for our program directors. And so this conversation was specifically designed for vascular surgery program directors so we can help our colleagues be successful in shaping and navigating the interview process. We hope to create a thoughtful conversation to spark intrigue and a little controversy maybe in this new era of in-person, virtual, and hybrid interviews. So after hearing a little bit of buzz about unique interview designs, we wanted to get right into it. Evan, would you do the honors of asking one of our panelists our first question? And oh, before I start, sorry about that, Evan. I also wanted to remind everybody you can ask questions and put them both in the Q&A as well as the chat, and then we will address them at the end of the webinar for about 15 minutes. So feel free to put them in at any time. All right, Evan.
Okay, great. Mary, how about if we start with you? So are you able to adequately determine in 15 to 20 minutes if the person that you're interviewing is somebody that you really want to spend the next 5 years or 2 years with?
So I think you can. You know, from my perspective, part of the screening process and the first impression is in the applications that we're reading, the personal statement, the letters. And so we almost have a little bit of a bias going into it, an impression that's been made about the candidate. And so in that time, I'm really looking for concordance between the impression that they've given in their interview or in their application and how they interview.
Anybody else on the panel think a little bit differently?
I think I agree with Mary in the fact that we have a lot of information about the applicants before they come. I find it very difficult to judge somebody with a 15-minute conversation or 20-minute conversation. I tend to use it to make sure I can communicate with the patient, with the applicant pretty well, that I understand him and that he can carry on a nice conversation. So that's kind of the main thing I use the interviews for. I have to admit that I do interviews for general surgery and vascular surgery, and I've been wrong about a few people after they come and join me, and didn't realize that they weren't a good fit. I find it very difficult. I really do. And I'm happy to hear any ideas from any other panels. I'm going to ask Elena what she thinks about this and how she uses it, uses the interview.
So I think it's such a complex topic, and there are all your biases playing in effect in those 15 minutes interview. So what we do at our institution is we follow a holistic review. So basically, all the applications have been already revised for multiple people in a holistic place. So when I see the interview, like just the interview moment, just about the interview, I try to separate myself to everything that I know about the person and try to just judge or evaluate my interaction at that moment. We do a tiny exercise before about biases. And when I finish, I try to consider the opposite about that person, even for a couple of seconds, take a big brief pause before I score the person, reflecting in my own biases and how other people will see this person in the opposite way. It's a fascinating topic because it's like we do short interviews between 12 and 15 minutes, panel interviews. But we know that even having a short interaction with the applicant before, either a handshake at the BAM during the fair or the reception, the people that can make it to the reception the night before versus the people that don't make, it changes your perception of the applicant. Just having that tiny contact, a human contact before, it biases you in a favorable way towards that person. I personally think that you can, but I take it like the same way. We do structured questions, so I can basically know what I am looking with my other panelists in my room, and I know that different people will be looking for different things in their rooms. It's not a system that is perfect by far.
I'm really curious about a couple of things that you said, and I'll come back to it in 2 seconds. I would just want to ask Charles real quick, do you think you can get a good impression in 15 minutes about, since you're coming at from the other side, and then maybe you've experienced interviews already trying to get colleagues to come and be with you. What do you think?
Yeah, I think, and in my limited experience as an interviewer, but thinking back to my time as an applicant, I think it's actually easier for the applicants to get an idea of some of their questions answered during an interview than for faculty and residents to get their questions answered about an applicant. What I was really interested in when I was applying were things like case mix, experience, research presence, and cordiality, collegiality. And I feel like I usually, after spending 20 minutes in a Zoom room with somebody, I was able to check off all those boxes, or at least I had a good idea of it. But yeah, I mean, certainly, you know, as an interviewer, again, this is limited experience. I've only been through one cycle, but it's difficult. I think that the questions that have been the most valuable so far are the ones that are consistent and reproducible. You know, because I think it's hard to get a good idea of who people are as applicants unless you're asking them kind of the same questions every single one. So that's what I try and ask everyone that I talk to, at least one of the same questions, so that I have something to go off of, even though it's all subjective, some type of objectivity to it, to who people are and what they're about.
And then you can measure your response because you're asking the same question a little bit more stringently, potentially. All right, Elena, so, sorry, go ahead.
All right, I don't know how you guys feel, but from my standpoint, I'm trying to figure out in 15 minutes if you are somebody I can talk to at 2 o'clock in the morning. And that's what I'm trying to figure out in 15 to 20 minutes, to be honest with you.
I think all of us.
I'll add to that is not only talk to you at 2 o'clock in the morning, but can you give me a nice story and tell me what's wrong with the patient at 2 o'clock in the morning? That's kind of what I'm looking for.
So
And can I trust you with that information?
I think that's part of the challenge in trying to make this determination in 15 to 20 minutes. I mean, for me at least.
Right. Or at least have the potential to build up to being able to tell that story. So Elena, you said a couple things in your response too that I want to ask you a little bit more about. You said you do panel sessions. Can you describe that a little bit more and what that means? not everybody does panel sessions versus one-on-one interview sessions.
So they're not completely panel. There are at least 2 faculty per resident, per applicant per interview. Some of the room are 2, some of the room are 3. So depending on how many faculties and how many rooms we do. And it's a structured interview. So as Charlie says, it's like we do the same questions every time. I have my set of questions. The other person that interviewed with me have her own set of questions that we ask in the same order to all the applicants, and trying to probe in different areas of the skills that we're looking for that person. And then in the other room, people, because we are all so different, and that's exactly what we're looking for, the difference of the values that we're bringing, is they will ask for different questions. But at least the first 4 questions are like, was a 75% of the interview is a structured interview. And the last few minutes is more relaxed and chatty, and what they want to know about us, or what do you like to do? But the first questions are always the same, in the same order, and trying to compare, trying to get a sense of what the person brings to the team and where they came from, and can they say that in a concise way in this time.
Mhm. Mary, how about you? What do you do for your interviews?
So we have faculty dyads interview all of the applicants. And I think on the one hand, we've thought about, is that intimidating to have, multiple faculty versus one applicant, but actually the faculty end up playing off each other quite a bit. And I'm pretty strategic in how I pair the faculty together. So if it's someone who has certain tendencies in their interviewing, I might put, who's someone who's a little bit more rigid and I guess intimidating. I might put them with someone who brings a little bit more levity to the conversation. And the faculty have actually really enjoyed it. They have, they have a nice time. We have several sites. And so it's also a way to bring, to kind of bring 2, multiple viewpoints into the, about one topic into the interview process for the applicants. So it's been pretty well received. I don't have prescriptive questions for the applicants, but let the faculty kind of decide the approach that they're going to take in terms of their questioning. And I'm consistently fascinated by the information that they get from applicants that in my wildest dreams I could not imagine extracting from an applicant in discussion. Good things, not not questionable questions, but they really get the applicants engaged.
Do you guys have, when you guys do, in my institution, we pretty much do one-on-one, faculty to interviewee. Every now and then we'll have, 2 faculty. Do you guys involve your trainees in the interview process? Do you have a trainee sit with a faculty member, or separate interviews by just the trainees? Or, typically what we've done is we have a separate session with just the residents so that they can sort of ask the resident questions. But I just didn't know if you have your trainees involved in the actual interview process.
So we do. I'll pair a senior trainee with a faculty member for their professional development as well, kind of seeing how the interview process goes and even getting some mentoring in that. Concurrent with that, we have we're still doing all virtual interviews, but we have a virtual waiting room where we have all of our residents. And so during that time, in between interviews, the applicants have an opportunity to ask questions of the residents who pepper in and out of the session over the course of the morning.
And it's all virtual, Mary, just for clarity.
Yeah, we're all virtual still.
Is anybody doing in person yet on the panel?
Yep, we are doing in person. We did in person last year, and we're doing in person again this year.
Yeah.
We're in Seattle. We're not in a sunny place.
Is that better or worse?
And we do have, one of the rooms is usually 3 residents or 2 fellows and a resident, 2 residents and a fellow that do there is a whole room that's interviewed by residents, by trainees that are going to be your co-fellows or co-residents in hopefully next year.
Mhm, mhm. And Evan, I'm sorry, is it okay if I ask Charles what he thinks about panel versus one-on-one? And
Yeah, here we do, we don't have a breakout room for the residents. I think the attendings do one-on-one interviews, with the interviewees, which they prefer. And then we do paired residents, with each of the interviewees, which I think helps with the conversation and it takes some of the tension off. So that's my preferred way. I think that in breakout rooms, just in my experience with the residents, it's very easy for people to be silent. And so I prefer smaller numbers because it forces people to talk, and in general, I think that's a
yeah, and as Mary was saying, if you have kind of this ongoing dialogue, you'll find out just a little bit more. There's little hints about personality and so on. Were you ever uncomfortable, Charles, when you went through the interview process, when you had a panel versus one-on-one, or?
no, I don't think so. It all just depended on the questions that were being asked.
Right.
I think there's pros and cons of both, but the panel, certainly not a bad call.
Yeah.
Well, how about maybe not uncomfortable? How about intimidated? How about if you were when you were sitting? The only thing I can sort of relate to is when I was taking my oral boards and I'm sitting across from the people that like wrote the books and wrote the landmark papers. What was that like? In the interview process? Because God, I don't remember mine. It was so long ago.
Yeah. Well, I can say this. I certainly, I was not put through oral boards during my interview season. There was nobody. I wasn't asked any, quote unquote pimp questions or anything like that. But I think people were more interested in trying to align what I was looking for in a program with what they were. And I think that there are ways of gauging an applicant's understanding of the specialty or their commitment to it or interest in it without asking those questions about specific management of vascular diseases. So I was never put through something that's akin to oral boards during my interview season. And for that reason, I don't think I felt intimidated by that process. That it wasn't something that I experienced.
Yeah. It appears, Ben, you have your hand up.
I'm mostly just enjoying learning how to use Zoom still. Besides my 50 lessons. See, now I don't know how to get rid of it. Oh, there it is, his lower hand. There was something that I wanted to reinforce that Mary said, that when you talk about this idea of panels or multiple peoples, that I have found to be interesting in our group. And I'll just go ahead and disclose, we do a hybrid, probably because I thought that the work we did with that last year, actually, I really enjoyed that. So I think we can efficiently get through the boring part of interviews, which is the actual interview on Zoom, and I think extract the information as you guys have already outlined. But I do like to give them opportunity to come to campus to see our city if they need that, right? But we don't make it mandatory. So that's my disclaimer. But we do our actual interview part as dyads as well. And I have found over the years, Mary's exactly right. You need to think about who you put in the room together. I think it actually can make a difference, but I think it can really, that experience can augment either person. And it helps because every group's got one person who just, they meet a person and they come up with a completely opposite feeling than most everybody else has. It's good to have somebody else in that room with someone. So if someone's like, God, this person is whack, and everybody else really liked them, you can look at the other person in the room and go, did you get that feeling? And it's been helpful at times. I have found we've been interviewing in pairs for about, even before the pandemic, when we were doing all in person, but we have just found that to be a real boon for our program. Maybe it's just a personality thing. We're fortunate enough to have enough faculty that works. And we let the two chief residents interview as a pair together as well. So I just wanted to reinforce that. I have found that to be a super helpful way to do this.
So
And I would add to Ben, we do the same thing. We have dyads and then we have a separate room for the fellows. But it helps the interview. It helps the staff go through all the applicants much faster. So so it decreases the amount of time the interview is, because I think it's important that all the staff that are involved with teaching have a chance to talk to all the applicants, and all the applicants have a chance to chat with the staff. So that worked out really well. And then we keep the fellows by themselves because we want them to be as honest as possible without attendings around. So they feel they can say what they feel like about the program, good and bad. And I think that's really, really important because you want the right match. You want the person coming to your program to understand what they're getting to. And if you have a faculty with the fellows, we found that the fellows tend to either are quiet or tend to not say everything that they want to say.
So
Yeah.
I'm going off script here for a second, but so when you do your post-interview meeting, reviewing everybody you interviewed, how much weight does what your trainees have to say in your decision making as to, if the trainees say they really like somebody and the faculty really hated them, or the faculty say they really liked them and the trainees say they hated them, how much weight do you guys put into what the trainees have to say? Since they're going to work just as closely, if not closer, with the people than we do.
Yeah, it's a lot, right? And what people listening to this, they have to realize once you're interviewing, every single time you're interacting with a trainee, with the program coordinator, or with a faculty, you are being assessed and you're being evaluated. 100%. I can tell you the number of times the program coordinator emails me, says, this guy was really rude, or the fellows tell us after the interview, we picked up on this fellow that he's either lazy or he told us the story that reflected that. And on the contrary, we have people that say, this guy seemed really, really awesome and really, really great. Much different than they were able to interact with the faculty, maybe because they were shy or a little bit intimidated. So going back to Evan's question, we put a lot of weight on what the coordinator says and what the fellows say. Mary, do you find the same thing?
I do. I put quite a bit of weight in the impression that the residents have, particularly because we afford a lot of opportunities for the trainees to meet, to interact with the applicants without any faculty around. And so kind of, again, going back to this idea of like concordance with their application and their interviewing, is the impression that they make on the other trainees what we're getting? I mean, are they a consistent individual, or are they putting on a good performance for a faculty-based interview, or are they someone that their interactions resonate with the trainees? We have a really tight group of trainees who actually all get involved with the night before social that we do, which we've even been doing through our virtual interviews. And it's been fascinating, some of the things that they have picked up on, even in a virtual format.
So I'm going to switch topics just a little bit. So if you go through the interviews and you have standardized questions, do you have a point system? How does everybody go through after the end of the interviews and think about their candidates? Elena, you want to start?
Oh, yeah, we don't have a point system for vascular surgery. For general surgery, we have a different metric. But for vascular surgery, everybody gets, every trainee gets rate immediately after the interview. And it's a form that we have. It's on a scale of 1 to 3 in multiple different areas that look at different, there are different questions about the academic potential, the multiple spheres of what a person brings to our team is going to complement our team, the interaction, the communication skills, and we try to come we do a ranking basically based on that, and that's what we discuss. Like immediately after we finish, our amazing admin and came with a score. And we look at all layers, and that's exactly what I think that Mary was mentioning, the person that got rated very low in one room, or for one person and very high in another room, and trying to find out what happened. And we all pay a lot of attention to what the residents and fellows tell us about the applicants for multiple reasons. And one is the social event the night before all the faculty go, but we disappear at 7:50, like very early. We're like 45 minutes to 1 hour, and after that we let them to stay with our residents to chit chat. And again, you will hear some personality traits arise, and the residents giving us a lot of feedback. And the same thing during the interviews, the residents will give us a lot of feedback about those interactions. We have 2 days of interviews, so we cannot really finalize our list at the moment, but we try to do it as soon as possible. And we'll write a lot of comments about the interview.
Then it's fresh in your mind. Lloyd, how about you?
So we do have each faculty has several areas they need to grade the interviewee on in terms of does he fit, like Lena, his academic potential, even though we're not that much of an academic center. We have areas that is he a good guy in terms of clinical judgment. So we have about 8 stuff, and we grade each one of those characteristics that we're looking for from a grade of 1 to 10. And then we have a overall interview score. I tend to find it a little bit helpful, but I tend to look at the overall score and overall fit. And it's a very subjective number that we give to the patient. It's just not the patient, I'm sorry, the interviewee. It's a very subjective number. Do we think he'll fit or not? So that's the way we've done it. I think it works well. But like I said at the beginning of this, we've had people that we thought were excellent fits, and they just did not work.
So I'll just jump in with another question here to keep things moving. So for me, ever since this virtual interview season, everybody can just click on as many boxes as they want to apply for programs. So for me, after you've reviewed an application and you look at the application and they look so good on paper, but you're thinking there's no way in hell they're going to come to your program, do you still interview them? And I'm speaking as someone who interviews way too many people. So, Lloyd, I don't know, you're big on my screen. You go ahead first.
I do, and I look at it as I'm looking to get the best resident fellow to my program, and I'm very pleasantly surprised sometimes that some people are looking for certain things that I don't think of. So my current fellow, he came to Detroit. He liked the Middle Eastern flavor in Detroit. And he really enjoyed the community that was there, that he's going to support him for 2 years. So I think that's really important. And you'll be surprised of what people are looking for. You may not know until you give them the chance. So I always say, who's the best person that we think is the best fit for our program, and rank it that way.
How about everybody else? This is just a problem. This is just a recurring problem that I have. And
yeah. So I will say that I really hope the vascular surgery decides to use Signal. Signaling having proven in ENT and other specialties to really help us with this question about where is your real interest, and it will help us at least narrow down the number of applications. I'm concerned about the number of places that medical students are told by mentors and faculty, not even vascular surgery, but at the School of Medicine, that they should apply. I'm talking about people applying to 60 programs this cycle, plus 30, 40 backup surgery programs. Like that's out of control and unrealistic. And we need to find a way to stop. I mean, I'm really happy that people are applying to vascular surgery, but this is a really interesting situation that's being created, the fear that the applicant have, even for amazing institutions. So that's one of the problems. So I am biased. I hope that we get Signal, and I am surprised that we didn't got Signal this year. But I do hope that we have Signal next year to help us, because I'm in Seattle. I mean, and that's one of the reasons that we do in-person interview, because it's a long hike here. And you're going to be most probably far away from your family if you come to Seattle. And so it's an interesting situation. And when you do virtual, is the commitment, and it's difficult to show you I'm not trying to sell my program. I know that there are no students here. It's difficult to show you such a great place we have and what a beautiful city we have, unless that you came here. So it's a tough problem to have. We actually historically only have 1 day of interviews, and we switch to 2 days in order to have more people interviewing. Because I am like I prefer to look at the application, and I hope that if somebody looks great in paper and I want to meet that person would choose to come and meet me.
I mean, I think now, looking at the applications, like all of the applicants are just phenomenal on paper, which is another challenge. That if we're just basing the interview invitations on how applicants look on paper, we might as well just be shaking them up and picking however many interviews we're going to do, because really the candidates are so outstanding with their research, their experience, their step 2 scores, everything that they've done. I think for one thing that this question, kind of also brings up is kind of the ongoing evaluation of the identity of our program, and our programs and what we have to offer. I mean, an applicant who very clearly wants to have strong basic science research as part of their training and have their own lab in the future in an academic setting is probably not going to be the best served at a very clinically heavy outcomes-based research program. And it doesn't mean that that's kind of the program's identity forever, but as a program's identity evolves, I think that's where we also look at fit, and are we going to be what an applicant needs. Now, again, applicants may say that in their application, and their needs and interests change over time. But if it seems like there's very clearly a mismatch in identity, just based on what we know of our program and what we're interpreting in the application, then we might be disinclined to offer even an outstanding appearing candidate an interview spot, particularly because there are, again, so many outstanding candidates that their application is better aligned with our goals and our identity for our specific program.
I have a hard time being in Philadelphia interviewing somebody from the West Coast with 78 pages of publications, where I am a clinically heavy program with no, basic science type stuff, but they look so good on paper, throwing them out of the interview pool. I haven't wrestled with that problem. I don't know how to fix that problem yet, to throw out somebody who looks too good on paper. And that's one of my problems. That's kind of why I threw that question out there for you guys.
Charles, how about you? If you were running your program, would you interview everybody you possibly could? What would you think? And then even thinking about it as a candidate, were you glad to get interviews that you thought were high reaching for you, or what did you think?
Yeah, so I'll start with a disclaimer that I'm not involved in interviewee selection at all. So like seeing a giant pool of applications and having to pick 40 or so, however many kids from that, I can't speak to how difficult that is, or parsing between them. That's just a dilemma that I haven't faced yet. When I applied, I applied everywhere, and that was the norm. That was something that was recommended to me by every vascular surgery mentor I had. And I'd probably recommend any medical student to do the same now, only because my number one goal was to match. I didn't care where I was in the country. And so, that it creates difficulties, but I think from the student's perspective, just looking at the numbers of it, I think that they feel a little bit forced into doing that slightly. I'll say that, but one of the other questions on here that, before we were asked to prepare for was, what is a good interview question? On the flip side of that, I think that the imperative interview question that I feel from my perspective as an interviewer now is why us, which always kind of instilled fear into students applying. But I think it does get at the heart of if somebody's going to apply everywhere, they have to have a good reason for it, and they have to have done their research ahead of time about every single program. That one forced me, as far as being prepared for certain questions, to have done that research, and already preliminarily, I had a good idea of whether or not I would be a good fit for this institution. And so that's something that I try and ask everybody who we interview these days. And I think it's actually the best question for programs to be asking medical students, because you get a really good idea of if they care or not. You get a good idea of fit, and if they've been asking themselves those questions leading up to the interview.
I think that's incredibly insightful and really informative. When just to inquire a little bit more about that, when you were doing your research about a program the night before or the week before or whatnot, where you're like, oh, this may not be a perfect program, but I'm going to see what happens. Did that ever happen to you while you were going through? No, that's for Charles again. Sorry.
Oh, sorry.
No, that's okay.
When I was doing my research, did I ever come across whether or not it would be a good fit for me? Yes, all the time.
Yeah.
And I think that yeah, it's certainly, it's the type of thing that when you're not making your rank list yet, because it's not February, it's not, late January, but when you're thinking about programs, certainly things, fall up or down your list based on what you are and are not interested in. And there were plenty of interviews that I thought that about going into it. And then I ended up talking with faculty and residents, and I was surprised. I was surprised at how clinically busy places were, or the research that they were or weren't doing. But I think it's the imperative question. And Dr. Kuroga, to your point about signaling, I also hope that it becomes a part of the vascular match, because I think it is something that's absent. At the same time that I feel that, there are a lot of people who are probably in the same position as I am. They would be happy to match anywhere. They don't care if it's far away from family, which I am right now. They just want to be trained for 5 years.
Mm-hmm.
I don't know. I would argue that the best signal we have is if we all went back to live interviews and you had to spend money and travel. That sounds like the best signal to me.
I could not agree with that more. I prefer live to the Zoom meetings, but.
Yeah, I don't know. I tend to, I'm not 100% sold on signaling. I think it limits the people and the potential. I understand why you want to do it, but it having people apply widely opens up the pool for other programs and have them come take a look at places they may have not if they didn't. So I'm not 100% sold on signaling. So I'm going to oppose Elena's push for signaling, because you have to convince me better, Elena, that's a good thing.
I do want to say a caveat. I am in favor of signaling. I don't know exactly what's the right number of tokens. I know that for CT surgery, 3 is too little. That you can only signal like 3. That's not enough. 15 for general surgery, I think that's a sweet spot, because you're putting your 15 preferences. That's a little better, but 3, I hope that we don't go with 3. That's not enough. The applicants deserve way more, and exactly for what Charles has said, it's like you want to try to apply. I think that the numbers have to be between 12. I don't know how to even look at the data for that. I follow a lot the literature on this topic, and we don't have enough data, especially because the real data will not be much applicants. For me, the data is board certified surgeons, attrition, change of program. It's not just getting one foot in the door, it's graduating that person to be a surgeon.
I mean, 15 sounds like a lot, considering there's only 77 or how many programs we are these days. I mean, that's 20%.
15 is for general surgery.
Yeah,
General surgery this year got 15. So for us, I think that 3 is too little. That's what CT surgery, the similar size that us got. So I don't know what's the number. 7, 9, 12.
So Charles mentions what a good interview question is. What do we think some terrible interview questions are that we should never ask? I'm a big fan of the why do you want to be a vascular surgeon? I think is an awful question.
So I'm going to start that question with that two different kind of questions. There are awful questions that you like roll your eyes as an applicant internally, not externally, when somebody asks you that question. And there are illegal questions that you should not ask. And we as program directors are responsible for every person interacting at any moment during the application process to uphold the code of conduct. So that's very important. People know that there's a lot of questions that you cannot ask. Some are the very obvious, as you're working, I am working in a state institution, like they're discriminatory questions, but there are others that are a little a surprise for people, like where else are you interviewing? That's a forbidden question, and you are not allowed to ask that question. And I personally am biased. I think that people should not be posting pictures in Twitter of the people that interview and that they are their program, because that's an indirect way of know where people are applying. But that's another topic. But what we do is we send an email to our faculty the day before, and we do that in all the programs. And we said a reminder, like a big reminder of all the topics that you cannot ask and all the forbidden questions. And we give like very specific example. Like you have a very unusual last name. What is your origin? That's a forbidden question. How many interviews are you doing? What are your top programs? You cannot ask what are your top programs. And we also give examples of great questions that you can ask. A question that you can get some information, but it's different. So that's now people can talk about awful question, but I just wanted to talk about illegal question that as a program director is a very relevant topic, because we know that the applicant's opinion of a program goes down if anybody asks an illegal question.
100%. And do you guys send your faculty the illegal questions as reminders before you start? Yeah, us too.
Yeah, I want, since this is going out to the people who are interviewees, I would encourage you people, the people who are watching this, if a faculty asks an illegal question, please email the program coordinator and let her know that you asked a legal question. A lot of the times the program directors don't know, and they need to educate the faculty what they're doing wrong. I was surprised by a survey that was presented at the APDBS last year. The amount of illegal questions that the residents and fellows were asked, this was a survey that was sent to the residents and fellows, was quite high. I don't remember the exact number, but it was quite high. And we need to do better to educate the people who are interviewing about that.
And prefacing a question with, I'm not supposed to ask this, but asking the question does not absolve.
Does not make it okay.
It's actually, it's one thing that I have found the interview dyads, the faculty have actually kind of policed each other. If someone asks a question, the other faculty member will jump in and say, don't answer that, like so-and-so, you can't ask that question. And it kind of helped change the culture and kind of diffuse what otherwise would be, a awkward situation for an applicant to know they're not supposed to answer it, but they're not really empowered in that position to say, I'm not going to answer that. I mean, hopefully they would feel that way, but we know what happens in real life.
Charles, were you asked questions that were illegal and or awful?
No, I was never asked any illegal questions about things like where else I interviewed or how many interviews I had, things of that nature. As far as bad questions go, at the risk of giving a broad answer, I would say just questions in general that are unprepared. And I'd say the same thing to any interviewees. If you haven't done your research ahead of time, that's bad. But obviously, you handed a packet about people and I read those ahead of time, but you also flip through them in real time because I don't remember anybody. Or everybody in full detail. I couldn't hope to. So I have to remind myself who they are. But if it's the first time that I'm looking at it, I think that shows to interviewees, and it's a big drawback from a program if you realize during the interview, this is the first time that they're looking at you. So
I'm curious, when people are asking questions, how much of your interview time is spent asking, say, non-medical questions and just trying to get to know more about it, as opposed to, what you would, I don't know, what you would consider a doctor question or a medicine question or something along those lines?
I think, Evan, that's where having sort of a plan on where you're putting people on the interview day helps, right? Because I have a few partners who all they can ask is, what's your favorite case you've ever done, or what case made you want to, and that's who they are, and they're not going to be different. And that's okay, because when we meet as a group, they bring that information. I spend my entire time asking them questions that have nothing to do, quite frankly, with their research or I want to know generally what they're, but I think their application tells you a lot of those doctor questions. And so I want to figure out if these people are going to fit in with my current group of trainees. But we all have to meet. You have to meet right after the interview's done, whether it's virtual or in person. Everybody needs to sit down right after it's done and go through those people right then when it's fresh. And if you do that, like I said, your whole group will parse that out, and no one applicant is just getting hammered with the same thing every time. But I kind of know who's going to ask those questions, and I sort of beforehand prep people. Like, I want you to focus on the things you like to talk about, and that is how it works for us. And I mean, it's something I feel like we've gotten better at the longer I've done this. When I started doing this, I think our interviews were not very good. And I think they're better now. They're not perfect, but they're better.
I can tell you that I remember the first year or the second year that we did interviews. There was a guy, and his side hustle was like he was a professional wrestler. And being a kid who grew up in the 80s, I think I spent 19 of my 20 interview minutes talking about professional wrestling with a guy.
Sure. Well, that's a way to find out if they're authentic, right? Like, people put a lot of stuff in their application, and sometimes they put in there because they think it sounds like what we want to hear. And if you actually have some sort of inside knowledge on something, especially if it's obscure, I actually think it's great if you spend 5-10 minutes parsing that out, because I can tell you pretty quick whether somebody actually knows anything about golf or not. And if they put it on there to make it out like they were good, and they don't know their stuff, then I know that they're FOS, and that actually is helpful too.
Mm-hmm. So there's a couple questions on the chat, and I don't want to ignore them. Should APDVS put out some guidelines in terms of the questions that should not be asked, and in terms of other guidelines for the interview process? I think that's a fantastic idea.
The ACGME definitely has guidelines about what are illegal type questions. That's easy information, and we could send out that.
Easy to
link.
pass along, right?
We could send out that link in a heartbeat. I have it somewhere, so that's an easy one.
Yeah, and that's from Abai, and so we appreciate you bringing that up, and that's an easy ask to share, even with SBS or through SBS Connect, and so on. So I love that idea. And then Ben Pierce posed the question: how many of you get unsolicited emails from applicants? I feel like that is a form of signaling now. That happens all the time, I think, doesn't it?
I get unsolicited emails all the time, and they tell me that how my program is their number one choice, and then occasionally they'll put the wrong name of the program down. So
don't do that.
I can tell you sent out this email to every program director, everywhere. I don't know.
So,
how does everyone respond to those? Okay, sorry, go ahead.
No, I always, during the when we do the introductions, one of the things I set expectations is one of the code of conduct also established that we should limit post-interview interaction with trainees, and technically the interaction should be started by the applicant, not by us. I set very clear expectations that I don't expect a thank you note or like a post-interview note. And if I receive a note, it will be a standardized answer, and it's always the same answer. Thank you so much for interest. It was a pleasure to interview you. Unless something outrageous happened, that's fine. And please let me know if you have any other questions. Happy to discuss. Blah blah. But I tell them that day, because after that it's like, and I'm very strict about that. I don't follow anybody on social media, any applicants, because I don't want anybody to think that following this person but not this person is a signaling, and that's on today's Chinese life, that's more important than an email saying I will rank you number one. Just an Instagram follow is way more value, and will not slide into anybody's DM for trying to get a rank list. But it's a topic because we get so many unsolicited emails, and this week we got an email from somebody that had not been applied to our program, talking about what Ivan was saying. Like, we went back, we pull again. Like, oh, this person that didn't even apply. My admin was a little confused about what we were getting an email about the interview.
You mentioned social media. I'm curious if you checked the social media of all the people you offer interviews to see if that
No, that will
qualifies them on your list.
No, that I think that will inflict too much bias on me for one reason or the other. So I'll actively restrain myself to do it. And if anybody wants to engage in a conversation, one of my trainees, oh no, I don't want to hear, I don't want to know. I understand the temptation, let's say.
Mary, what do you do when you receive emails?
So the unsolicited emails, kind of requesting an interview. I just have a standard response regarding where we are in the application process, and not that they'll hear from us one way or another necessarily. I don't put too much weight in it for the same reason that was described by Evan, which is that they're not necessarily often specific. And I don't know, I've sort of noticed that maybe it's some of the weaker applicants that are sending out the kind of queries or requests for interviews. But I guess along those lines, and I would kind of pose this as a follow-up, is to what extent do we as program directors or applicants using or looking at acting internships away rotations as another form of signaling? So if I'm reviewing an application to my program and they didn't do an AI with me, but they did 3 other AIs at similar or other programs, how much of that is a signal that really those might be their priorities over my program? I know a lot of other things factor into decisions to do an AI in one location or the other. Maybe they have family, it's convenience, but how does that play in as a signal as well, I guess?
For me, the devil you know is better than the one you don't. I mean, in the 5 years that I've been doing this, honestly, we've only gotten one of the people that has come and done a rotation with us. And sometimes that was our choice, and sometimes that was their choice, I guess.
I'm asking this particularly to this audience because I noticed that a lot of great applicants that we get coming through have done AIs with Elena or with Ben, and I think, like, why didn't they do one with me?
So I am surprised about that, because I hope that this is recorded, but not everybody sees this. And the UDAP system for medical students is going through a reshuffle, and getting supervised to do the rotation with us has been incredibly challenging. Like, we only got like 5 per year only of everybody that applies because of the delay in the system. I love having visiting medical students. I also know that's a big commitment to go to some place. I never see it as a signaling to, like, when I see an application and they went to other places and didn't come to me, I never see it like that. But I have to say that anecdotally, almost every year we match a person that rotates with us. I think that I'm trying now and looking at, yes, like, of the 2 positions that we have over the last 5 years, one person always did a survey with us. And I always said to the applicants, it's like, to the medical students I'm mentoring, doing a SUBA is a big commitment, and it's like a 4-week interview in a certain way. But after that, you kind of get to know the person very well. They get also to know you, and they're the person that know your program and the vibe of the program and the everything, and they may be the best ambassadors of your program when they go to another place and rotate. I don't see it in a negative way, like I'm not signaling, but it's different when it's somebody that you met and they interview with you. But you also have to be realistic. We are going to interview, I think, 35 people this year, close to 30, 35. And actually, no less, like 30. And only 5 people did a survey with us.
Charles, did you do sub-Is before when you were, before you embarked on the interview trail?
Yes, I did 3 away rotations. None of them were places that I ended up matching, so I don't think it was ever a signaling thing for me. I didn't utilize it in that way, but it is certainly something that I look for when I'm reviewing a packet. I think from what I've heard, a lot of vascular surgeons do that as well, just looking at the letters of recommendation from away rotations, and it's one of the most helpful things, I think, when I'm looking at somebody who I have never met before. More often than not, they've rotated with somebody who I did an away rotation with, and so it's helpful to be able to have that information.
I find it interesting. So we don't provide the applications to our fellows at all to try and have them completely blinded. We do that intentionally. So the fellows can just have a heart-to-heart conversation with a candidate and vice versa. And it's really interesting to me hearing you be so thoughtful about somebody's application. Does anybody else do blinded interviews with some of their faculty or trainees with other candidates?
We remove the step scores and the school grades for there is a core group, the education group reviews every single application and they get access to all the information. But for the interview process, and this is for some faculty, I have to tell you that's difficult for them to understand why we do it in that way. But the applicant have already passed that test, and it is not about you got honors in this rotation or your step 2 score. This is about the interview process and how you interact with the team. We remove, I think that we leave the application, the personal statement, and the letter of recommendations. But we remove the school grades and the steps grades. And for the fellowship, we remove the upside grades as well.
So the numbers portion of it you remove really essentially, and then leave the essay portion and letter recs type of thing. Interesting. Anybody else? What else? Nothing different. Lloyd, how about you? Anything different?
No, I'll leave everything in because I try to treat, we're 7 or 8 people that interview, and I try to treat all the faculty like program directors and have them be as involved as possible. And like Elena said, some people get upset if you don't share all the information. I understand why they do it, and we do the same thing for general surgery. We just get a personal statement, and it's a score totally on the interview. But I think when you're interviewing for fellowships that we have, we really want to know the whole person from A to Z, and each of the faculty want to know the whole person A to Z as much as they can.
Well, I think we're coming up on the 9 o'clock hour here in my time zone, at least. Does anybody have any parting advice or anything they want to add before we wrap it up? And obviously, I want to thank everybody who came tonight and participated. And me and Kelly really appreciate your help with our inaugural webinar for the both of us, for sure.
No, Kelly, Evan, thanks for doing that. This is really great. And I think it's really helpful for the people who are interviewing to listen to this, to get a perspective from the program director's side, what we're looking for. And Ben, thank you for supporting this.
You all are awesome. Appreciate you very much. And the webinar will be posted after this is over, and through SVS Connect it'll be sent out. All right. You're awesome.
Thank you so much.
We'll see you
Great night.
later.